Good afternoon, everyone. We thank you for logging in. We're going to give about another 2 minutes to allow some more attendees to log on. Good afternoon, everyone. Again, we're grateful and we're thankful that you decided to join us in this very important panelist discussion regarding the pandemics that we are facing in our lives at this present time. Um, we are grateful for our panelists, our moderator, but more, we are also grateful for the Wiser Mental Health Ministry. I think that it is my task to pray. After I pray, I will hand it over to our moderator, our very own Dr. Cheryl Al-Mateen. Again, we thank you. We ask that you would ask the questions that you need to ask, and do know that this is an engaging conversation for information and also for questions to be answered that will come along in questions and answers. So we want to say thank you and God bless you. Let me pray. Gracious and Heavenly Father, again, we thank you. We thank you, O Lord, Heavenly Father, for all that you do, all that you have done, and all that you will do. Your provisions, your protection, your love, your compassion, and your help means everything to us. So we thank you for this ministry. We thank you for our panelists. We thank you for our community. We ask and we pray that you would continue on watching over this world in a special way. You know those who need help. We ask and we pray that you would give them that help. And then we ask and we pray that your spirit would be with us in this panel discussion, this virtual roundtable talk, that our lives will be changed and we'll have a little bit more strength to continue on in this week and the weeks to come. This is our prayer. In Jesus the Christ, we say amen.
Amen. Thank you, Pastor. I'm going to share my screen now with everyone. All right, welcome to my video's not on, I don't know why.
There you go.
Okay, all right, hi. Okay, welcome to our virtual roundtable from the Wiser Ministry at Spring Creek Baptist. Our topic for this virtual town hall, our roundtable, is COVID-19 pandemic transitions, anxiety, grief, and coping strategies. I want you to know that one of the words that I have learned in these past 10, 12 weeks is syndemic, which means that there are two or more afflictions interacting synergistically, contributing to excess burden of disease in a population. What we do have and what we have seen most clearly over the past 10 days to 2 weeks is that not only are we dealing with the pandemic of COVID-19, but we also are dealing with issues related to race in the United States of America that have been going on for a long time. So while we will not be specifically talking about our second pandemic during this particular virtual roundtable, we just want you all to know that there will be an upcoming pandemic that will be addressing that second aspect. It will be given jointly by multiple ministries. Wiser, SALT, and the 116 Student Ministry will be participating in some way, and that is to be determined later. This is our program for the afternoon. We've already had Pastor Cooper giving us our opening prayer. And the next thing that we have is an icebreaker poll. After that, the panelists will introduce themselves, and then we will go through the many questions that have been submitted to us. And then there will be time for you all to also submit some questions via the chat in Zoom. And then we'll do an evaluation just to make sure that we get some feedback from you all about how we're doing. And then we're leaving ourselves a little bit of time to just finish up, and we will be done by 5. So I thank you all for being here, and I'm going to turn to Angela, who's going to start our icebreaker poll. And let me stop sharing.
Hello there, everyone. Thank you so much again for coming. We greatly appreciate it. You will be getting a poll sent to you right now. We just want to get some icebreaker information from you. We want to know kind of what you've been experiencing. So if you take just a few seconds to just answer the questions that come through, and then we will get started.
And these are anonymous, right?
Absolutely, they are anonymous. We won't know who it's coming from, what questions, and what answers are coming from who. So feel free to answer it very freely and openly. Wonderful, we're getting some results, and thank you.
And when will they be able to see the results of the poll?
If I am able to, I will post it as soon as we get full participation. If not, we can definitely share it.
Okay. And right now we have 26 attendees. So thank you to everyone.
Okay, we're almost there. Okay, I'll give you guys about 5 more seconds to just get these last ones in.
Mm-hmm.
And just as a quick reminder to anyone, if you are watching this and you realize that there's someone that could be watching this as well, please send them over to Facebook, send them to our Spring Creek website, the Spring Creek Facebook site for live, and you'll be able to see this as well. Okay. Okay, we're gonna go ahead and give it just one more second. I see that the one person's trying to put one in. Okay, we will end the poll now. Let's see, and I will be able to share these results. So as you all can see, we definitely have some folks, a majority are saying they're having some mixed stress going on right now. Let's see, personally being impacted. We definitely have some that, are more indirectly, and then quite a few that are not personally impacted. Let's see, the rate, quite a few are feeling the overwhelmed feelings, which is great because that's what we're going to talk about today. So we'll be able to talk about some great coping skills and some strategies for that. And the national news, awesome. Okay. So wonderful. Thank you guys so much for putting this in. All right, Cheryl, I'll send it back to you.
Okay, thank you. All right, so at this point, I'm going to open up so our panelists will be able to introduce themselves, and then I will start to ask questions. So I am going to stop sharing here. You can see that our panelists are Dr. Trishana Glover Hassell, Ms. Kimberly Hines, Ms. Rita Ricks, and Reverend Freda Wilkins. So I'm going to open up in that order so that you all will be able to introduce yourselves. And then I believe that once you're talking, then everyone will be able to see you. Okay? Stopping sharing. And okay, we've unmuted Trishana, so you should be able. Thank you, Angela.
Thank you, Cheryl. Good evening, or afternoon, or morning. I'm Trishana Glover Hassell. I am a physician that specializes in internal medicine, geriatrics, hospice, and palliative care. My role today is to give information related to COVID-19 and how it has affected patients throughout Virginia and throughout the country. I just wanted to give you some basic facts about COVID-19 to begin with. It's a novel virus, which means this is a new thing, a new virus that hadn't been identified, originating from Wuhan, China, thought to be from the wet market scene and not in a laboratory. It's spread through droplets, so talking and singing, coughs and sneezes can all cause spread. Contact with surfaces that have the virus on them can also make someone infected if you touch your eyes, nose, or mouth. Symptoms include cough, fever, malaise, headache, feeling tired, sore throat. And all of these symptoms can be seen as part of another virus, such as the flu. But then there are more severe symptoms with COVID-19 that include shortness of breath, that can lead to pneumonia. We also have evidence of people getting clots, so DVTs or clotting of the legs. Clots in the lungs can happen with COVID-19. And people can have no symptoms at all, or something as innocuous as a loss of smell and taste that's been described. So risk factors for getting severe disease. If you get it, hopefully you're one of the ones that will have 2 to 3 weeks of kind of the bothersome symptoms. But those of us who have heart disease, diabetes, high blood pressure, COPD, cancer, such as lung cancer, any blood cancer, or if you have cancer that is spread to your other parts of your body, people who have chronic kidney disease and obesity, and people that smoke are all at increased risk for severe disease. And in particular, Black and Latino populations appear to have a disproportionately high number of infections because we tend to have those underlying diseases, but also because of socioeconomic and health disparities. Age also plays a role in this. So we've seen more hospitalizations in folks over the age of 50, although anybody at any age can get COVID-19. At present, there are no approved therapies or vaccines, and we've been fortunate that rates of death have decreased over the weeks. And that's in part because hospitals are learning more regarding supportive therapies when people are very ill. And primary care and urgent doctors have learned when to advise patients to seek medical attention. So if you don't hear anything from me, hear this. What can you do? Social distancing is key. 6 feet apart when you can, being outside versus indoors if you're going to gather. The University of Virginia has estimated that that measure alone has decreased infections by 700,000 in our Commonwealth thus far. You should use face masks and coverings and limit outings as much as possible, especially if you have those risk factors. That's all I have.
Thank you. Thank you so much, Dr. Glover. I do want to share with folks that because Dr. Glover works for the federal government, we wanted to be very careful to have her give general statements so that there wouldn't be a misperception that she was speaking for the federal government. Our other presenters all have a level of confidentiality, also have a level of confidentiality in what they can share about their experiences. So they will not be telling you extensive things about individuals that they have worked with, but just a gestalt of what they've experienced and to give you a little bit of information about what their area of work is. So I'm going to mute Dr. Glover and then unmute Ms. Hines. Okay, Ms. Hines, you want to introduce yourself?
Yes, I'm Kim Hines. I'm an outpatient therapist in private practice, as well as a registered play therapist supervisor. So I see kids as young as 3, up until mid to late 20s is pretty much my sweet spot with seeing people. I see a lot of kids that have histories of abuse and neglect, being in foster care, adoptees, grief and loss issues, anxiety, depression. I would say that, now we're totally telehealth at this point, which is online therapy, since it's not necessarily safe to be in person. And so there's definitely been an increase that I've seen with anxiety, worries, not knowing what to expect, lack of structure with kids, grief and loss. I have had a couple of families who had experienced COVID-19 on a personal level, so that's been difficult for them. For littler kids, the little kids that I do play therapy with, you can't necessarily do that over a screen, so I've been doing a lot of support with parents around emotional dysregulation and how kids are responding to all of this, not being at school, losing contact with their friends, losing everything that they knew. And little kids are doing relatively okay with it. I would say the teenagers that I see are struggling more than anything, because they were used to, being free, doing their own thing, and even young adults and college students that I've seen. So, I'm glad to be a part of this forum, just to be able to share how kids, adolescents, and young adults have been dealing with this from again, like you said, we can't be specific with clients that we see, but at least generally offering some resources for parents and teenagers around how they can be helpful to their kids, how young adults can be helpful to themselves, how parents can manage this, because a lot of parents are struggling also. And I don't want them to think that we don't know that. Parents have been asked to be teachers. They've been asked to do a whole lot of things that they never had to do before, and continue to work and continue to manage their households and worry about, family members. So hopefully we can touch base with all of that today.
Thank you. I will now ask Ms. Rita Ricks, to introduce herself. Hitting unmute, and there we go. Angela, can you help me? I'm hitting it and it's not quite.
Okay. Good afternoon. My name is Rita Ricks. I am a spiritual coach, and that means that I show my clients how to live from the inside out. And I want to just share my experience with COVID, because it was a bit traumatic from the beginning, because I get a call from my kids like the second week of March, and they say, "Mom, they're saying everybody over 70 has to go home. That's you." Well, duh. And so I'm like, well, what do I do? And they say, either you drive home now or we will come get you. And so I packed up my office and I drove home. And I sat there all evening really dealing with the fact that because I'm over 70, I was at risk. I had never felt at risk about anything. I have a trainer twice a week. What was up with this? However, the next day I got a poem. So a couple people sent me this poem by Kitty O'Meara. And this poem said that we are in what I call a pause. And we're in this pause to get ourselves together. We're in this pause because we're moving too fast and we don't know where we're going and we're struggling and we're not together and we're talking about each other. And this is a time for us to just shut down. And that poem changed my perspective of why I was at home. And by changing my perspective, it changed my reality. Because what she said was, by us slowing down, we were going to have the opportunity to heal the planet. And I felt that and I loved it. And I said, well, oh, if it's the planet, I think I can settle down and be quiet. And it has been amazing. I also train entrepreneurs. I facilitate a 6-month entrepreneur course. And needless to say, we all had to pivot in our businesses. And the innovation that has come out of us being paying attention, writing a plan, not having to travel back and forth, has just been wonderful. And I will tell you, as we go through this afternoon, the value of silence for me is immeasurable. It is so important that we are quiet so that we can hear the direction God wants us to go forward in. So that is my story. I'm okay with being over 70. I'm healthy, and I'm delighted to be on this panel.
Thank you. And last but not least, we have Reverend Freda Wilkins, who's going to introduce herself. Reverend Freda.
I'm good. Good afternoon, everyone. Thank you, Dr. Al-Mateen. I'm excited to be here. I'm Freda Wilkins. I am a social worker with Massey Cancer Center. I work in the outpatient clinics. Most of my work is with women with early stage breast cancers, although I see patients with all types of cancers. I am also Reverend Freda. And as Reverend Freda, I have spent most of my work time as a missions minister. So I've been missions pastor at churches. I love my dream and my goal is to help people connect with the gifts that God has given them and live that out. In terms of COVID, I'm not so much dealing with patients who actually have COVID, but my patients who are already anxious about a new diagnosis of breast cancer are now experiencing even more heightened anxiety because of how COVID is impacting everything. And right now I do 2 women's support groups for women with cancer. So we've pulled them together and we meet every other week and just create a space for people to debrief, to giggle a little bit, and to talk out their emotions. So we try to provide space for people to cope with their stress and to understand that what they feel is not, patients ask me all the time, am I normal? Is this okay? So what we say a lot to people is, this is perfectly normal. This is where you are. And let's talk about how we're going to help you navigate this. So that's kind of what I do. Thank you for having me today.
Thank you so much. And thank you all for coming. I have a list of questions that I've shared with the panelists ahead of time. And I want to start off with, especially because we have seen that some people have had indirect impact from COVID, and there are few who have had direct impact. The first question that I have is, how do I deal with grief if there isn't a funeral? And I've asked all of the presenters who do therapy type things answer to that question. So I think if you all raise your hand and let me know who wants to talk first, then I can, then let's just do that. Would that be you, Freda? Okay. You should already be unmuted.
All right, I am unmuted, and these are the kinds of questions that I'm talking with my non-breast cancer patients about right now as we talk about anticipatory grief and preparing, working our way through the dying process. And I think it's important first that we remember the purpose of funerals. Funerals are rituals that allow us to acknowledge that someone is gone, to deal with our own grief, and to acknowledge our pain and to deal with the meaning of life and my own mortality. So funerals, while our culture wants to avoid death, funerals provide us with a place to express, a healthy, accepted place to express our grief and our pain. When we don't have that in the physical sense, it's important that we create space to have those experiences, to be affirmed, to acknowledge that person's life. How do we do that? We do what we're doing today. There are many ways. We use our social media and our technology to do virtual sessions. There are people who are having very small funerals, and at the gravesite, people are arriving in their cars and being supported. There are people who are doing, if you guys were like me, growing up in Eastern North Carolina, the setting up. There are people who are doing the setting up and the repast by Zoom. So we can't all come together, but we can certainly all get our plate of potato salad and sit down together. People are using online legacy pages. So maybe I can't visit you, but I can type out what Uncle Joe meant to me. I can send you cards. And if I am the person who has a loss, I can be intentional about beginning to journal. The things that I would normally tell Rita, I can write them out. I can call Rita up and talk about it. I can begin to pull together video montages that map that person's life and allow me to remember. So we don't have the funeral, but we have the opportunity to continue to be community. And I suggest thinking out of the box and knowing that people are still there for you.
Thank you. Okay, I have to mute you, I think, so that I can unmute Kim. I do. Okay, go ahead, Kim.
Okay. I guess I could speak from a kid and a teenager perspective, since that's the majority of what I see. And I always talk to kids about drawing pictures for their loved one that's passed away, or writing something that would go in a casket, or something that would go, in an urn necessarily. But if there's none of that, you can still do the letters and the pictures. Talking with parents about making sure that they're talking about the good things and good memories of the person that passed away. People have their own ceremonies and celebrations in their backyard. I've had families that have planted trees, planted flowers, have, a special place in their house where they have different things from a loved one, and so especially at this time where, I have a client who had a family member that just passed, not even from COVID-19 a couple months ago. They were only allowed to have 10 people at the funeral, which encompassed pretty much all of the siblings. So everybody else, wasn't able to come. And so they decided to kind of do their own celebration, afterwards. They did some Zoom things. They did some stuff at houses, at families, other houses to celebrate. So it's not really confined to that. And it's still, you're able to grieve, because I think that's important. And, some people don't, it's honoring the person. So if the person doesn't really want the doom and gloom that sometimes funerals can have, this gives you an opportunity to have a celebration, if you will. You have cookout food, like Reverend, Freda talked about. You have favorite things that people like to eat, and you talk about good times and honor that person and allow kids and teenagers to become a part of that. I talk to parents all the time about the fact that, kids really need to have some type of closure. And even if there's no casket and you're not at a funeral home or at a church, you can still have some closure with doing all of those celebratory things and not making them not a part of stuff. So.
Thank you. Thank you. Anything that you wanted to add, Ms. Rita? Whoops, hold on for me. Okay. I am, nope, that was wrong. Hold on, I am having a hard time unmuting people. Angela, I need your help with this.
Okay, I unmuted me. It said
okay, thank you.
So, no, Reverend Freda and Kim, that was excellent, because I too believe that we have to celebrate. We're supposed to celebrate even when we're there. I love the different suggestions that you all had, and I also agree with getting away from the doom and gloom. I had a client who lost their dad a couple weeks ago, and so not only was the funeral live streamed so people could participate, but it was recorded so that they can watch it even today, and that was 2 weeks ago. So I think any of these ideas, and it really is, we are in a different space now. And some of the things that we used to do, we're not necessarily going back there. And so thinking out of the box is where we are now. Instead of feeling sorry for what we can't do, we absolutely have an opportunity to create new and different.
Yeah. And Dr. Trishana, I have a question for you, which is, how does hospital staff help people who weren't able to have their family members with them at the time they died?
That's a very good question. Different things. It's always important as a physician to have a strong social worker and a strong nurse behind you, because the nurse is at the bedside. The social worker is often the go-between with the family as the physicians are doing more technical things. And so some of the things that I've heard in the time of COVID, because the hospitals aren't able to have a lot of people come into the hospital exposing themselves, exposing staff, some hospitals are able to grant a visitor if a person is expected to pass away, not necessarily from COVID, but from other illnesses. They come in with masks, lots of hand sanitizer and washing. There are also programs where the bedside nurse will have access to an iPad. And so if the family member has an iPhone or access to an iPad, they're able to see their loved one. And if the person is able to communicate, and see that the family member is there for them, that can be very comforting as well. And then some other things that places do, doing the handprints before death, with family and patient permission, doing like a cast mold of a handprint. and then being able to give that to the family to kind of memorialize that time. So it's not an ideal situation, but I can tell you that, hospitals and nursing homes and areas of hospice are doing the best that they can. And like Ms. Rick says, they're thinking outside of the box.
And are there, and just to make sure, because it seems that there's a delay when either Angela or I tries to unmute one of the panelists, we're going to need you guys to unmute yourselves. That seems to happen immediately. So I'm going to add a question. What recommendation, and we have it from one of the attendees, what are the recommendations for those who are healthcare workers, people who are on the front lines, who haven't been able to, take the pause? How do we recommend that they try and sustain themselves during these losses and during this time?
So I saw that question and I think it's really good, but we have to take the pause. We have to take the pause. It doesn't matter our title. If we're not healthy, we can't help anybody. And this is something that I hear sometime, well, especially with my entrepreneurs, well, nobody else can do this but me. Some of the time, and I'm certainly not using this for everybody, but sometimes it's ego thinking nobody else can do this better than I. And then we get overwhelmed, we get run down. And so I just encourage everybody, you have to take that pause for yourself, for your clients, for your family. You have to take that pause. I mean, it's not an option not to take it.
And I 100% agree with you, Rita. And at least in my health system, and I would think in most places, we're very aware of the stressors that everybody is under. Right now, my department has small huddles every week where we can just kind of de-stress. So whatever I encourage people to take advantage of what's available. If there's an opportunity for you to talk, for you to use a Wilkins room, which is just a quiet room with quiet lighting to just relax, take advantage of those things. As Rita said, many of us feel like I can't, people need me. If the health system is allowing those things, take advantage of them. And be sure that you are doing your own self-care, that you're exercising, that you're watching your diet, that you're sleeping, that you're taking a day off if you need one. Doing the self-care, that you've got somebody to talk to about how hard it is. So be intentional about caring for you. It's sort of like in the airplane. Do your own mask first, and then you can help everybody else.
Okay. The next question is, I've heard two versions of this question. So the adult version is, I'm a social, affectionate, hugging person. How do I relate to people without touching them? And the child version is, how do I help my child not go and hug everybody that they see, especially with this worry about asymptomatic carrier? So who would like to go first? Kim.
I have to laugh because, I feel like the montage of the last 13 weeks for me talking to parents is that kids don't know how to social distance, especially little kids. So I've talked to them about what is safe to do with peers right now, if they feel comfortable with them being around other people. Super soakers are great because you don't have to be around each other like hugged up, but I can still spray you. We can have fun. Bike rides are good. Skateboarding. Hula hoops are great for like 3 and 4 year olds. You stay in your own hoop. They stay in theirs. Now, there's some kids that they're not going for that. And I think it's easier to manage when, you know, say you go to a park now with another family and you can do, you know, the jump rope and the things that you don't necessarily have to do to be so close together. School is another can of worms. And I know there's a question coming down the line about school and, you know, safety. I honestly don't know how they're going to handle school, especially for little kids. You know, kids are like super glue. They're like magnets and Velcro. They're all over you. You know, they hug their teachers every minute. They hug their peers every minute. You know, I think it's easier when everybody's at home, and, you know, every kid that I see, they understand to a basic level, you have to be safe and wear a mask because you don't want to get sick. And, you know, you can't really hug everybody that you see anymore. And there's options. So you can elbow bump people, or, you know, something, not even fist bump anymore. Doesn't even seem to be safe. But, you know, I think in smaller groups, you can manage kids in the ways that I talked about. In terms of adults, I think more adults are getting into, you know, Zoom things, you know, that people that are in fraternities and sororities and different friend groups, they're having Zoom meetings once a week. They're getting together. My husband does it. They've done it about 4 times with his fraternity. It's a way for them to see each other and connect, but not necessarily have to, you know, be next to each other again, until it's safer. So.
And on the adult side, are we using hula hoops for us too?
I guess you could use hula hoop for adults if they're up for it, but, you know.
I can't handle a hula hoop. I'm using Zoom. Any other from our other panelists, any additional?
I love everything that Kim said, and the using technology to connect. I strongly encourage my patients to acknowledge how they feel. Just being able to say, this is hard for me. Because hugging is our way of feeling connected. It's our way of being part of our social circle, and it's healing for us. So we find other ways. One, we acknowledge it is so hard for me to not hug. Find ways to be generous, to be community in other ways. Volunteer, give, do things that will open up your heart to the feel-good feelings. From another perspective, one of the questions I saw ask, how do I deal with the barriers? Mm-hmm. What if we reframed that and the barriers became an opportunity for us to express our Christian love?
So you mean the mask when you say that, you mean the mask? Because that's the next question. Perfect.
Yeah, so what if my barriers became, I wear this mask because I love Rita and I love Kim. And part of my command, the first command is to love God. The second command is for me to love y'all. So instead of this being the barrier that limits me, maybe it becomes a sacrament. And it becomes, come on, Rita. I mean, because, you know.
I love that. I love that, because I was going to say that I hug myself, you know, because I really love me. And so there are times when I just hug me because I miss hugging. And so the more I hug me, the more I love me. And it helps. And I want to remind folks that, again, the mask and the gloves, I'm telling you, I go out and I got to go back because I forgot the gloves. Oh, I forgot this, I forgot that. But I continue to recognize that I am helping to heal the planet. Yes. And this planet is going to be here way after I'm gone. So this is the sacrifice that I am now making for my grands and my great-grands and the ones to follow. And it seems to me to be just such a small sacrifice, because we still are in our homes. We still have food. COVID-19 is on my body right now, you know, with what I'm eating. And so it's just a matter of saying, let's look, change the perspective, and you change your reality. So yes, Freda, I appreciate that. We got to look at it differently in order to be able to celebrate rather than complain about it.
And then we go, and I know we got to move on, but I just want to add this last thing, that the Baptist tradition and most of our Protestant traditions, the sacraments are baptism and communion. So when I wear my mask, I'm really saying that I am becoming broken bread and poured out wine for my brothers and sisters. And hopefully every time that I run back in the house and get my mask, because I forgot it, and I wear it, even though it's uncomfortable, what if that became a sweet smelling savor to the nostrils of God?
Amen.
That he said, look at Freda down there,
Man.
doing like she's supposed to do.
That's nice. One of our participants on Facebook Live shared with us that they had a Zoom birthday party, which was wonderful.
Exactly.
My niece had a Zoom gender reveal
Yes.
for her baby. So, and it was national. So
That's good.
this is great. Okay, the next question is, and this relates to wearing the mask. Trishana, can you talk about what kind of masks people should wear? There's people wearing all kinds. I see cloth masks, I see surgical masks out in the world. Sometimes I see what looks like it should be an N95 mask. Can you talk about what people should know about masks?
Sure. So I guess the first thing is that you wear something, which is important. And the other thing is making sure what you're wearing you're comfortable with. About a month ago, there was a story about someone wearing an N95 while driving, almost passing out and getting into an auto accident. So you have to be mindful about what you're wearing, you know, in what situation is it appropriate. So, you know, for most people going to the grocery store, a cloth mask is really what you need. The best cloth mask, you should hold it up to the light. If it has, if it's very porous, that material is not as good, because what you're trying to do are the large droplets. You're trying to prevent those from having access to your nose and mouth. Like cloth, like a bed sheet, is more appropriate. You don't want anything too stretchy, because when the material stretches, that's when there are holes there. And so that's not as good. Healthcare workers, you know, depending on, you know, what type of care you're giving, can be anything from a surgical mask all the way up to an N95. In face shields, you know, I see people wearing face shields. A face shield without a mask isn't as helpful. The face shields are really good for eye protection, because COVID can access our eyes. So, you know, if you want some extra protection, face shield is, you know, is good. But, you know, make sure you are wearing something that covers your nose, mouth to your chin, okay? But also something that's appropriate, that you can halfway breathe in and not pass out.
Can I make sure I understand this correctly?
Sure.
That the cloth mask is helpful to make sure that other people don't get your droplets.
Right.
The surgical masks help other people from not getting your droplets and help you from not getting their droplets.
Yes.
And the 6 feet is because that's about how far droplets go with a sneeze, or, yeah, you know, those really intense singing and other things that,
those,
you know,
are the smaller droplets. The smaller droplets travel further. The larger ones kind of shoot out and go down pretty quickly.
Okay.
The social distancing piece is really important along, you know, with the masks. But, you know, I know a lot of people feel like it's restrictive. You know, I've seen things on Facebook that says it causes, if you wear a mask a lot, it's going to lower your immunity. You know, that's not true. There is a lot of misinformation out there. And so I really encourage people to go to either the CDC website or our Virginia Health Department to get the real facts.
Thank you. The next one, and this is for everybody, about how do I manage my anxiety about going back to work? Let's start there.
I never left work.
Okay, neither did I. But for those
Nor did
people
I.
who did take the pause, right, who were not considered essential and had to stay home, or for people who worked from home, how should they think about this?
So I just went back, actually, I went back Monday, but I am in a co-gather workspace, so it's a little bit different from there being a whole lot of people in your area. But it is the word anxiety that I want to focus on, because that being anxious is not helpful. It is about understanding that while you were at home, that you were taking care of yourself, and that now that you're going back, you're on this, you're in this forum today so that you can hear the mask that you need and how you take care of you. We mustn't live in a life of fear, because it just weighs on us. And all we can do is take care of ourselves, follow the instructions, stay 6 feet apart, wash your hands. That's what we can do. And just ask God to continue to bless us with good health, clear mind. We don't have that spirit of fear. And if we do, then that's what we need to be working on more, because it just can eat you alive. It really can. And so I encourage you to go back to work with expecting, and I love Freda, she's using my word, be intentional about where you are. Take your lunch with you, you know, my desk has got all kinds of gloves around it and everything. So you're intentional about what you're doing, but expect that this is still going to be a great time for you, that you're still going to be creative, that you're still going to be healthy. You have to expect it.
So the knowledge that they're getting here can help them with the anxiety.
Absolutely.
These are the ways to keep safe.
Yes.
Anything else anyone wants to add?
Can I just add real quickly? First of all, 80% of what we worry about never happens.
Correct.
That's just, most of it never really comes to pass. And worry really comes about because we're either spending a lot of time in the past or we're rushing ahead.
That's right.
And so a big piece of controlling worry is learning how to be present in this moment and intentional about that. In Matthew 6, Jesus tells us 3 times, do not worry. And the Greek word for worry really means to choke, or the word he uses means to choke or to strangle. So worry is really a way of choking the life out of us and keeping us from living the fullness that is available to us. And worry has a little bit to do with, I'm kind of saying, yeah, I come to church and all of that, but maybe God really isn't able to take care of my stuff. So I need to work, I need to rush ahead and take care of it. Being mindful, staying present in this moment, meaning I feel my anxiety rank up, I stop, I breathe. I say either verbally or to myself, I feel anxious. I feel whatever I feel, acknowledging what I feel and staying in this moment. And then finding an anchor. Find the scripture, find a poem, find some words that have meaning to you. Say out of Psalm 46, be still and know that I am God. I need to be still in this moment, but find settling into this moment. We get grace is given to us day by day and moment by moment. The word tells us, don't rush ahead. Don't worry about tomorrow. It's got enough problems for itself. Being aware. How does your body behave when you're anxious? I figured out I stopped breathing. I start finding how so that now I can recognize, oh, Freda, you need to breathe. Settling down and then breathing, focus in here. And actually acknowledging when I get tightened up like this, I'm really saying, oh God, you're really not big enough to do that. So I'll help you out.
So let me go to the related question. And I just want to make sure that people know, if you have a question for the panel, please put it in the Q&A. I'll check that as we're going through, but I want to make sure that we get through the questions that were asked ahead. Presuming that school opens back up in the fall, will it be safe for the children to really return? And what about summer camp? This may still be a Trishana question.
Yeah.
Yeah.
So, gosh, safe is a relative term. So I think school won't look the same as before the governor ended school for all of the kids in the state of Virginia and others across the country. I think it's really going to be about schools setting up appropriate social distancing. It is not just kind of what they're doing with the structures, but also partnering with other governmental organizations such as the health department. For example, most schools only have one school nurse. As people get ill, one school nurse is going to be difficult. He or she will be inundated because, not only do they have to, worry about sick kids, and they also have to teach and give some education as well, health education. So it's going to be a combination of what schools can do with social distancing, what resources they have access to. Summer camp is kind of a hard one as well. My daughter went to summer camp for 3 years for 3 weeks each time. And I know that summer camps are trying to do shortened schedules this year. But again, what resources do they have? What comfort level do the parents have? And, are you going to exclude kids with chronic health conditions that otherwise, would go to camp? Those are really difficult questions. There's no easy answer. I think kids will end up back in school, but I think one of the most important things about that is if there is another outbreak or if there is another spike, that schools are able to pivot back to online learning pretty quickly. So there's not as much of a gap.
Thank you. How do I stay up to date with what's going on in the news without increasing my anxiety while watching the news?
I have talked to parents, since I see mostly kids and young adults, but especially I have some teenagers that are Google queens, as I like to call them. So they Google everything and they look everything up on the and it's never ending. It's not even just watching the news, it's social media and it's everything on the internet. I had a teenager tell me a couple weeks ago, that even on Nickelodeon, there was a commercial that popped up for washing your hands and staying safe, and we're in the pandemic. And so it's like, you know, the only thing honestly that's not showing stuff about the pandemic is Netflix, Hulu, like Amazon Prime, like those things, because there's no commercials. And they're just trying to get you to watch a million shows in a day, and it's fine. So I've tried to talk to my teenagers, especially teenage clients, about most of what the media is showing are the deaths, are, you know, the hard things that are happening, the hundreds of thousands of people who have gotten treatment and are better isn't necessarily shown over the other things. So I've talked to parents about turning their TVs off, don't play the news in the house. Teenagers about giving them options for what they can do. Watch Netflix all day, watch Hulu all day, I don't care. But if you go down this rabbit hole of watching, you know, going on social media and CNN all day and all these other websites that's all they're showing, then, you know, your mind just keeps going and going and going. And, you know, these are, you know, I have teenage clients who are scared to go back to school. I have teenage clients who are getting ready to go to college and don't really know what that's going to look like because they've been watching too much of the media. So we've talked about other things that you can journal all your concerns and, you know, do some other things to get yourself out of the house safely, you know, social distancing, but not so much focused on, again, the doom and gloom, because that will take you and spiral you down. And it's not helpful to your mental health at all. It doesn't, especially because there's no distractions right now. There's no school, you know, there's no friends, there's a lot of, you know, teenage clients I had, they're not working, or their parents aren't comfortable with them working. So everything in their life is gone. So all they have to do is perseverate over these things that are not so helpful. So, you know, trying to offer them alternatives. So, because if you do sit and watch it all day, it's mind boggling, and you will, you know, be in this puddle of the world's never going to change. It's never going to get better. And that's not the way that we want, especially kids and teenagers, to be.
Yes.
I love the journaling, and I think it is critical that we pour out what's in our heads. I call it my Dear God letter. You can call it whatever. But in the morning, I am writing what my concerns are. And I so agree with Freda, there is nothing I can do about yesterday, and tomorrow isn't promised. So I write so that my focus is on today and the direction that I have to hear from God. And so journaling just allows you to clear some space for the other gifts that you haven't even begun to use. And so as I continue to say, we've been on pause. Is it time for you to think about going back to school? Is it time for you to start that business? Is it time to create whatever it is you've been wanting to do and for whatever reason have not done? And so for me, this time, I looked at it as a gift to just really think about. And here's the question that I ask my clients and continue to ask: who are you going to be on the other side of this? Who are you going to be? Who are you going to be? So if, you've been struggling with your job, now's the time to research and write, write what you're going to do next. And you have choices. So as Kim was saying, if you stay on CNN, but you have choices. We always have choices. We always have choices. Sometimes one is just a little teeny bit better than the other. But when you are figuring out what are the results you want to see, then it makes it easier. But this is the time we have gifts that we will never use. Well, I'm trying to use on mine, but we have so many gifts inside of us that we've not used. And so all we have to do is just be quiet, just pause, take the time to say, what do I really want to do coming out of this pandemic? Who do I really want to be when I come out? Who do I want to look like? Those are just introspective questions that we should be asking ourselves and our kids.
So I want to take the word choices that you used and move to the next one, which is how do we deal with workers around us, family members around us, friends around us, and we have in the Q&A, how do we deal with other church folks who are around us who are who are choosing not to take the responsibility that they need to have to others, to wear masks, to social distance, and not being safe. How do we handle that? And how do we speak back if it's our leadership in a particular situation who's not allowing us to do what we feel is necessary to be safe? What recommendations do you have?
You know, I believe that again, we have a choice, and so we can either wear the mask or not. And because I was home for probably 4 weeks before I ever went out, and then I went out and I was shocked at people who were not wearing masks, you know, and I started to ask, so why aren't you wearing a mask? You know, and the guy said, well, I just had to run out here and do this. It's back on my desk. I have it. I just don't have it on. And it dawned on me one day, Rita Ricks, what they're doing is not your business. And you have to do what works best for you. And so I tend to sit further away or not talk, or not just stay away, because I really don't want to get into a back and forth with why somebody isn't doing what we know is correct. And so again, it's on me to take care of me and not try to make you understand why I'm taking care of me.
Any other recommendations from our panelists? Thank you.
Well, I also think because we mentioned work kinds of environments, if there are systemic issues, then I think we have to use our voice, which is what we're seeing all around us right now, to speak up, to request appropriate protective equipment, or suggest different work schedules, come up with solutions that you can present to say, wait, these things, the way we're doing things now, are putting us at risk. And I think we speak up for systemic things, and we recognize what the serenity prayer, help me to know what I really can do something about and what I need, what I need to let go of. And if that is creating anxiety, I wanted to kind of speak to what Kim and Rita spoke about before. I'm encouraging my patients, set aside 10 minutes a day, maybe 15, where you get to worry. Just worry yourself out. And then your timer goes off and you go live your life. Same thing with the news. I'm encouraging my patients who are getting obsessed, 15 minutes of news, or, but set a time and then leave that alone. But I'm really hearing kind of the serenity prayer that supports what Rita said. Do something about the things we can do something about, and learn how to let go of the rest of it.
So,
and after speaking.
I think that these are helpful, and I think it is really, you're clear using the system. So if you have a problem at work, you can go to human resources. If it's somebody that you have no responsibility over, you would accept, well, maybe I need to wear a surgical mask around that one. Let's see how long it'll take Amazon to get one to me, that kind of thing. What happens if you're in a setting, and our pastor has been very clear that we're not going back yet. We're going to wait. We want to take some time, but there may be other places of worship where the pastor is not recognizing what needs to happen. How can we, and there may be people who are watching this who are from other congregations. What is the best way, do we think, for people to speak back to their leadership in their churches and help them to know what may keep their congregation safer?
I still think the same things apply. You follow use your voice, follow your chain of command. If you have a deacon or the person that you would speak to, then you speak to them and make them aware the way that we're doing this is making people uncomfortable or is a legitimate risk. You know, some things are about perception and then some things are true risk. So you speak, follow your chain of command just as you would at work to make your concerns known. You are a part of that family. Recognizing that your church family also has choice and they may choose not to adhere to your suggestions. And then we have to make choices for our own personal safety and well-being. And that's not an attack on your church leadership or your congregation. But if something is causing my anxiety to go up and I cannot sleep because of what's happening at church, then maybe for the time being, I may have to rethink this and watch my church on Facebook Live or do some different things. And to do all of that prayerfully.
Yes.
So that, you know, I'm talking to God and saying, look, God, this is how me and God talk. So look, God, this is happening. I'm concerned. Show me the loving way to address this and keep my family safe.
And I think too. Hello?
Yeah.
Okay, I have feedback. Okay. So I think also that it is how we approach the leadership or anybody for that matter to say, not to say, I saw Freda doing this and I don't understand why she's doing it, but to say, I am very uncomfortable with what I see. I'm uncomfortable when I see people without a mask. Is there anything that you can do? And so you're putting it on yourself because you're the one that is asking the question. And then I totally agree with Freda. If nothing is done, now you got to figure out what you're going to do next.
Yes.
Anything else to add? There's even more Q&A coming in. We have a few more of the original questions. I think we've covered some of these. We haven't, so we have something concrete. Do you think that travel for vacation, even to somewhere like Myrtle Beach, could be safe? I think Trishana has told us that a beach is good, but I'm checking in to see if there's anything else she wants to add in.
So open areas are good plans. And especially open areas that you're able to social distance. When I saw that question, it gave me pause because you have to come up with a solid plan about how you're going to get to Myrtle Beach. You know, are you going to drive? What are your stops going to be like? Things like eating, you can take or, you know, pack a lunch or pack food or snacks going down, but then you get to the whole thing about, you know, bathroom usage and, you know, kind of planning that out. You know, getting there, my husband, so when we travel, my husband always laughs at me because I have my Clorox wipes and I do kind of my obsessive cleaning of the hotel room or wherever we are. You know, is that something, you know, preparing for that, you know, cleaning the area is important. And then kind of getting the layout of the land, you know, places that you're planning to go to. Are they going to be open? You know, are they appropriately social distance? Do you have your heart set on going to a particular museum, but they only let 30 people in? So I think, you know, careful plans if someone is electing to take a vacation, a driving vacation, you know, by plane, you know, you wear your mask, you're careful. Social distancing is, you know, hard on a plane, you know, with recirculated air. You just really have to weigh your risk and benefits. You know, if you have been set on doing your family vacation, you know, and this is something you feel like you have to do, then by all means do it. But just plan ahead, be thoughtful, not obsessive about it, but be thoughtful about it and have a good plan. And wherever you go, always have your mask with you. What if, there are a lot of what ifs, but I always say, if you have to get out of your car for an emergency or something, having that mask to grab and put on, that mask accessible to protect yourself is really important.
How long can you leave that mask in that car? How many days can you wear the mask?
Is it like a cloth mask?
I'm just asking for general recommendations.
So for me, I try to wash my mask every 1 to 2 days. I keep it on my console. And that's kind of the dirty area of my car. Grab it by the strings. I have a mask that ties up in the back twice. Grab it by the strings, able to fit it very well on my face. And then, every 2 days, throw it in the washing machine.
Okay. And if somebody has a surgical mask, I've seen folks with those.
Yeah, so surgical masks can be reused. It really depends on the amount of soil. So if you're a spitter, if you're in a situation where you've been close up to people and you think you've been exposed to COVID, definitely get rid of that mask. Kind of other things I see with masks, people put the mask on and then they pull the mask down to speak. You're not protecting anybody by doing that. You're actually contaminating yourself by bringing the cloth down, down your face. Speaking of mask has its challenges. It can be done. I know it's hard. But it can be done. You just have to be really patient and get something that fits you well, that you're comfortable with.
And then remember the reason behind it, because it's for protection.
Mm-hmm, mm-hmm. I know it's the other night I was watching CNN, and it was amazing to me how the people out in the protests were able to talk through their masks with the mic. And they've been out there all day long. So, we can do it. We can do it.
Okay. So I've got, how do I help my kids having behavioral issues during this time? And I know it's because they're tired of being stuck in the house.
I would say, and I think I said this in the beginning about kids, being emotionally dysregulated, i.e. having more tantrums than usual, behavioral issues, just not doing what they normally would do emotionally. So, I've talked to parents around, and, I'm glad there's no quote unquote school educators on here because they might smack my hands, but I'm not a fan, and I've not been a fan of, especially littler kids, doing schoolwork during this time, because it's important about you maintaining a relationship with your kids. And so there are some kids that can manage it, they can maintain it, but there are other kids that just can't. So then you find a way to bring school to your kids in practical ways. So you build forts in the house or outside, and that's science class. They help you cook a meal or bake cookies, and that's math because we're doing measurements. It's getting them outside and getting them to ride their bikes or playing in the backyard or taking them to places. There's a lot of community gardens right now that are open, that are allowing people to come and plant things. And so I have a couple kids that have done that with their parents. I think the key is talking to them about why they're not going back to school, because a lot of kids didn't understand it. They left school on March 13th thinking they were going back to school on Monday. And then they were like, oh, never mind, 2 weeks later, then we'll go back to school. Oh, never mind, we're going to have a long spring break and then we'll be back. And then it was, oh, well, school's over. It's done. You'll go back in September, maybe. So a lot of kids are just really confused, especially elementary school kids. And I've had kids tell me that they're confused and worried because their teachers just told them, as long as you wash your hands, everything will be fine. And this won't be an issue. People won't get sick. Nobody will die from it. Kids don't die from it. You guys are okay. And then they're hearing bits and pieces from what their parents are saying, what they're saying on the news. They realize, by the time it's all said and done, they're not going to be back in school for 6 months. That's half of a year. That's a really long time to not see their friends again, to not see their teachers, to not, these kids, they're not going to understand how to even do school when they go back in September, if they go back, in whatever way, form, or fashion that happens. So I think a lot of kids, when they don't understand what's going on and when things are not explained, they act out emotionally because they don't have the words to express it. But it comes out in their actions and their behaviors. So I think kids, there's age appropriate ways to explain what this COVID-19 is, what it really means, why you're not in school, when, kids, brass tacks, when are we going back to school? Why can't I see my kids? Why can't I see my teacher? I've had some kids who their teacher has not checked in with them since they left school in March. So and kids that have experience with trauma and abuse, they think their teacher has died or something bad happened to them. So they, there's all these things swirling in kids' heads that they don't really understand. There is an app that's really good. That's a free app called Worried Wendell and the Bad Germ. So it's a good one for little kids to see, and just explaining like what COVID-19 is and why people are wearing masks, why you have to be safe, all those good things. So I share that with parents a lot. Like on a basic level, just explaining, Sesame Street, just like they did the town hall meeting yesterday about race. They did one early on a couple months ago about the COVID-19, which was good with the Sesame Street characters. So I think those type of things can be helpful with just explaining this type of stuff to kids.
Did you say Worried Wendell? That's Wendell. And the bad?
DALL. Worried Wendell.
WENDALL.
And the Bad Germ.
And the Bad Germ.
Mm-hmm.
Thank you. So you've answered a few child-specific questions, such as, is there an appropriate age to talk to my kids about COVID? And you're saying it's whatever age your child is, you need to explain it in the words that they can understand. Kind of like telling them about the birds and the bees. Mm-hmm. You tell them until they look bored, and then
right.
you stop talking. Yeah. And then you come back when they have another question. Should we tell our kids what the symptoms are? Yes. At an age, at a rate they can understand. And how can you reduce their anxiety and worry? We've talked about this for adults. The way to reduce anxiety is to get knowledge. And so then they can operate off of what they know is true. And what do I tell them if their daycare or school is closed, or their arts program has been canceled, or we have to self-isolate? You tell them the truth. Mm-hmm. Okay. All right. We're doing well on our list, folks. Okay. So I've got a couple more. And this actually gets both ends of the spectrum. Can you speak to parents with children that have disabilities, and also for those who have older adults who are isolated? What recommendations do we have for these two folks on the ends of the spectrum?
I would say for kids with disabilities, and it's been really tough because I'm thinking about kids with disabilities that had special services at school. They might have been at specialized settings, like if they're on the spectrum, on the autism spectrum. I would encourage parents to really advocate for their kids through their insurance companies to see what services are available. You know, there are some insurances that are stepping up and paying for different services that maybe they didn't pay for before.
For example?
So if you have a child that's on the autism spectrum, they might pay for more applied behavioral analysis services, so the ABA services. They might give you more hours. They might provide a one-to-one that can come to your house if you're comfortable with it. I mean, the hard part about this is some of the agencies that are providing services don't feel safe coming into people's houses and vice versa. But if you're a parent whose kid needs these services, who doesn't do well just being at home and not having the structure and the consistency, then I think it's something to definitely look into. You know, some summer camps are opening, so I would like to hope that some of these camps for kids with special needs and disabilities will also do some type of modified plan. You know, the Phase On school is right across the street from my office. And they're starting to reopen slowly and have some kids come in the building. So I'm hoping that other places will do the same. But I think the first place to start is, you know, if your kid has a case manager, like through a local community services board, checking with them about, you know, if there's no services in school, what can you do for my kid? Talking with insurance companies on what's available that can happen right now. Because, you know, parents have kind of been, you know, this is, again, week 13 of this. This is a long time for a kid not to have the services that they really need, and parents to have the services that their family needs.
Yes. Yes. And then anything for folks who were on the older end, over 65, people who we think of as a targeted population because of the coexisting kinds of conditions that they have. Any particular recommendations for those of us with family members on that end, or just friends, loved ones from church even? How do we support older adults who are isolated?
So I can speak a little bit to that. We have been very fortunate that services that are traditionally for seniors, like home health, Meals on Wheels, not necessarily for seniors, but folks in that need the like hospice care services. We've been blessed that there has been very little interruption of that. I think once the home health companies and the hospice companies did the education and got the necessary gear, they ran with it. So thankfully, those services have not been discontinued. They're modified, you know, instead of a, you know, hot meal, you may get a brown bag, but, you know, they try to make sure that what you're getting is nutritious. You know, from that standpoint, there's been very little change with that.
Also, let me just throw in here real quickly. Dr. Hassell, you're right. The services, health-related services, have been great. Here in the Richmond metro area, the further you are out, it's been more challenging. But for persons who don't have some type of skilled or medical need, maybe somebody who previously was going to an adult daycare program or who just lives alone, there's really not a lot in terms of services. Senior Connections has a phone buddy kind of thing. That's not what they call it, but they will do check-in calls for socialization. I strongly suggest that for those of us in our faith communities, in our neighborhoods, that we're looking out for seniors who maybe don't get out as much or who just are more at risk now, so that we call, so that we see if they need when we're on our way to the drugstore, the grocery store, we offer to do some of those things. that we let them go ahead of us in the line, because it is very frightening for many of them to be out in public. That we help them learn how to do Zoom or how to do a conference call so that they can see their grands, or but just that we're engaged, because many of our seniors are not as tech savvy. So maybe taking some time to help them learn even how to do a conference call and what the code is and how all of that works. Those are the things that help. And even just calling, a 5-minute phone call every day. How you doing, Miss Sally? Will make all the difference. And for our persons who are in long-term care facilities, we cannot go in at this point. So people who were used to having church groups and all of, different groups come in, they can't have those now. So those facilities are doing FaceTime and Skype with family members and trying to make sure that people call. I have a group right now that's going to a facility and doing things on the lawn so that residents can hear the music and see. But just keeping in touch with our persons who aren't institutionalized and who don't have skill needs.
I have 3 more questions. We have done such a good job working our way through the questions. 1, we've talked about the various things that people have done during the stay at home. Are there any additional recommendations for what to do if someone ends up having to self-isolate? So we're on stay at home, but one person has to be separate in the house. Are there any additional recommendations for what people can do? Or it's pretty much the same kinds of things. Stay away from the rabbit hole of the news, utilize those the Netflix and the Prime Video that you haven't used before. Keep using that iPad so that you can talk to the other people in the house. Just do more of what we've learned how to do during this time. Is that kind of right? I think I see your nods from
Dr.
everyone.
Cheryl, there's so many books out there.
Reading.
That we've been wanting to read and we just haven't. There are awesome podcasts. Mm-hmm. There are really cool things on YouTube. You can learn there are really cool things on YouTube. And so again, if you are self-isolated, it is your time to just take care of you, and whatever it is that you can find to help you to do something. It is a time again for you to decide, I'm going to make the best of this. I'm going to make the best of this, and I'm going to do something a little bit different than I've done before. And so if you've been wanting to learn how to play the violin, now's the time, or whistle or whatever.
Or learn Spanish or Greek.
Yes. And guess what? Nobody's going to bother you. I mean, seriously.
Okay.
So it's all good.
Can I add to that? I just want to ask Dr. Hassell and Dr. Al-Mateen, if I need to self-isolate and I live with my husband and my 3 children and we're all in the house together, what do I need to do now that I have had a potential exposure? My family's still here. What do I do? Do I need to do anything different about bathrooms and cleaning and laundry and all those things?
I'm going to see with Dr. Hassell.
So there is a model where if you have multiple bathrooms, designating a bathroom for that one person. If you don't, having the Clorox and the Lysol to kind of wipe down the area after it's used by the suspected person of having COVID. And kind of the same things, if you're able to social distance, fine. The person who has been exposed, maybe, you won't be able to make the meals, during that time until you get, your test back. Even it may come down to if you're married, sleeping in separate bedrooms.
Masks within the household.
Yes. Yes, if, you know, especially if you're symptomatic, if you're coughing, if you have a fever, you know, definitely, you know, isolating yourself from the rest of the family when you're having to go out, you know, using a mask, your family using a mask, and kind of coordinating, you know, the movements within the house is most helpful.
We have a question that just came through that's related to that. Someone who has a home business who has to be careful that has clients coming and going. I think that the things that you just said there are relevant. Have a specific bathroom. That person needs to wear masks. You're going to wipe down everything in between clients, that kind of thing. Is there anything else that we would add for that? Yeah, it just needs to be like you're in the store.
Yeah.
Okay.
You have to just treat it, you know, as though every person that you see can be infected. They may not have symptoms yet. So you always have to be cautious, not filled with anxiety, but cautious.
But cautious. So 2 more questions. How do I know when I need professional help or if I'm just experiencing the stress that everybody else is feeling right now?
You know, I saw that question, and I really think we can all use professional help at some point. That is my response. I really do. I know that I have a couple of coaches myself. I have a spiritual coach, and I just don't think there's anything wrong with it. I'm pleased that the question was asked, because sometimes we look at it and say, oh, I don't need any help, but we do. And it isn't that there's anything wrong. I think the professional help allows us to keep things right rather than saying that there's something wrong. So I'm going
to jump in and answer this question because I'm a psychiatrist. So I would say that the answer to this is, are you at the same level of complaints that your friends have? If you guys are saying all the same thing and then you're still able to eat and sleep and you can share with your friends and everything is fine, then that's one way to let you know that you're having the same kind of stress. But if you and your friends are unable to eat, sleep, take care of your daily needs, you're unable to do your hygiene and things like that, then maybe all of you are not doing well. So if you're saying, well, I'm just like my friends and they're fine, but those friends are in that rabbit hole of the news and they can't get out and they're not functioning, then all of you guys may need some help. I want to get to one more question here. I think I answered this one live, which is, and this is for Trishana. Do we have something definitive about antibodies? Do we know that that will keep somebody from having symptoms the next time that they're exposed? Or do we know for sure that the severity of the disease will be less? Or are we still not sure?
We are still not sure. And unfortunately, there's so many tests on the market for the antibody piece that aren't proven. There's variation among those tests, you know, getting a false positive antibody. So if you have an antibody, it does not confer immunity.
You should not assume that it's immunity.
You should not. Okay. You should not. So until we get more research and stronger proven tests, and you know, unfortunately, it's going to take time. You really can't bank on that. Now, there are some instances where people have gotten COVID. It's been well documented. It's been a while, and then their plasma is harvested for their antibodies. And so in those cases, the plasma is a part of the blood. And so the blood is taken, the plasma part with the antibodies is taken out, and then given to someone else that is struggling with COVID. So those therapies are going on for folks that supportive therapy is not enough. But you know, if you're going to your doctor's office or like an urgent care center, I would really ask questions about what type of test they're administering and how accurate their test is before you go and take the test.
So they should still wear masks.
Oh yeah, you still have to wear a mask.
Protection. Still protect.
You just can't be like, I had COVID, I'm out in the streets. You still have to protect yourself and others.
Okay. Well, we have gone through, folks, I think we've essentially covered all the questions that I've sent out to you, right?
Yes.
And I've answered we've gotten the Q&A questions. So let me see, is there anything else that is left from okay, so folks, I need to let you all know that for the evaluation, this is confusing. You will probably get a survey in an email. It is also possible that at the end of this Zoom that you will see an evaluation pop up. We're not sure how exactly that is going to work. But I think the first thing the thing that I would want to do now is to see if there's anyone else that has a question that they had not asked. It is 4:44, so we won't be able to do the evaluation before this is done. But if there's anything else that people want to send to the Q&A, we're able to do that at this time. I can't tell if anybody's typing furiously. So I'm going to take this time while somebody is possibly typing furiously to just thank our panelists. I think this has been incredibly helpful. I've gotten questions answered that I didn't know the answers to, and I feel like we've done a really good job working on the list of the questions that we were given ahead of time. Oh, there was one, Trishana, for you. While we know that it's not gone, which is why we still have to wear masks and we have to social distance and all of that, do we have an educated guess about what next winter will be like? I know from the hospital perspective, you and I both work in hospitals. We know that that will be a time of the year that this kind of virus comes back because the heat and humidity is not a pleasant place for the virus. But when it's cold again, I think we'll be a little bit like we were just now, but we may not have to shut down. What are your thoughts about that?
So it's kind of a mixed bag. So there are a lot of different models regarding, COVID and how it's going to behave. So if you go with the UVA model, according to that model, there's going to be a second peak around August, September. And then there was some data that came out a couple of days ago that said, during the summertime, with relaxation of all the measures, you can see like thousands of new infections a day during the summer. Unfortunately, there's no good way to tell. The best advice I can give is just be prepared, any way it goes. If the heat works and it goes away, then that's a blessing. That's a pleasant surprise. But unfortunately, I don't think,
we just don't
it's going to work like that. And we don't know. So we just really have to be prepared.
We just have to be prepared. Okay. All right. Thanks to everyone with all of the protests going on, are we concerned that that we'll get another peak of some sort?
Yes. It's been a mixed bag of people wearing masks. It's hard to socially distance in a lot of those areas, and people are yelling protest while protesting. You know, that's what you do when you protest. You know,
And that's like singing.
Right, singing.
Mhm.
So we really encourage that those that have participated in protesting such as that, you know, especially if you get symptoms, please get a COVID test. Because you need to know, you know, if you have COVID, if you don't have, even if you don't have the symptoms, so you don't expose others. You know, even when measures were relaxed across the country around Memorial Day, we're starting to see an uptick since Memorial Day. So yes, that is a concern. That is a concern. We all just have to do the best we can, do what we need to do, and be safe.
The second part of this question is, will we be able to handle it? Now, my thought is, and I haven't been on the same units that you've been on, is that we have more PPE now. The whole purpose of the social distancing was to help decrease the curve, spread out the curve, right?
Right.
We weren't saying that people weren't going to get sick because of the social distancing. It's that they would get sick slower. Right? So that we would have enough beds, enough PPE, enough ventilators.
Right. And enough time to figure out COVID, to be honest with you. Like I said, rates of death have decreased. You know, it's because the scientists, the physicians, the other health professionals, the respiratory therapists are learning how better to serve COVID patients. So yes, it's about the resources, but it's also about the time to get the, you know, novel, to get to know the novel coronavirus that has been essential. So whatever happens, I'm confident that, you know, overall, we will be able to, from the hospital standpoint and from outpatient standpoint, be able to handle what's coming.
And then the next question is, do we have enough tests in Virginia to test the citizens? Because it's been difficult to get tested.
So I think overall, yes, we do. Tests are becoming more available everywhere. There still has to be kind of a pathway to, you know, deciding when to test, because you don't want to necessarily test and then get a false positive. You have to have kind of reasonings behind the test. So it being, you know, I was exposed to COVID, or I was in a large protest crowd, or my family member has COVID, or I'm working in a medical setting and I have these symptoms. I think the number of tests have greatly increased, and the time by which those tests are being processed has gotten a lot better.
Someone is asking, are we more concerned about a child getting the virus than an adult due to differing symptoms?
So, so far, when children get the virus, 9 times out of 10, they're mild symptoms.
Or no symptoms.
Cough, yeah, no symptoms.
Mild to no.
Mild symptoms. Now, there have been some cases of a rare condition, Kawasaki's, that has happened, where basically the immune system goes on overdrive to protect the body. And that has led to problems with organ failure, respiratory failure, and then, you know, the supportive care that, you know, goes along with that. But that's a rare thankfully a rare complication in children and in young people. We've seen it, I think it's ages up to 30. That's a rare complication, thankfully. But when it happens, it is serious.
Okay, I think we are going to have to end because for some reason, my computer's plugged in, but it is not taking the charge. So I'm going to go away in a moment. So I figure I should do this purposefully and say thank you to everyone for participating. The current comments that are coming through are that people are saying thank you for what we've done. And so it looks like we're getting really good response from those people that participated. So thank you so much to all the panelists. Please make sure that we have the address for those people that didn't give me their address. The panelists who haven't already given me their address, we need to have that. And I think that's it. Anything else that you all would like to add? I'm gonna say goodbye in case my computer shuts down. So, but you guys go ahead.
I have one question, Cheryl, if you don't mind. It's more for, it's for Reverend Wilkins. Reverend Wilkins, would you do me a favor and try to share with those of us who are listening the tension between faith and science as a person who is helping folk wrestle with what's going on, particularly with those individuals or our colleagues who said, you know, I believe in God, but yet and still put their members in harm's danger. There's real tension in that. So I named the real tension. I was just wondering if I can get you to share the tension with me while others are eavesdropping.
Thank you so much, Pastor. I read an article the other day that talked about the tension between the liturgy, which is not a term that we necessarily use a great deal in the Black church, but between the liturgy and the worship and our responsibility in the community. And there has been among many people, for many different reasons, some political, some self-serving, and some I couldn't begin to name. There has been this effort to say, we must continue to meet. This is what God has called us to do. God is greater, on, and even to imply that the scientific evidence that is given to us is somehow invalid or part of some larger conspiracy. So there are a lot of things going on out there for why people are saying what they say. What I would invite us to sit with is the concept of worship. We're commanded, forsake ye not the fellowship of the saints. We are commanded to meet together. And then there are the people who are saying the church is not the building, we are the church. And the church, truly, Christ lives in us. We are the church. But in order for me to be the church, I need you guys. I need to come together. I need the liturgy. I need the fellowship. I need to be a part of that community. So that is important. And I think we've been operating, if you watch social media, under the concept of it's either or. And I would say that it's more both and. I must have the liturgy. I need the community. I cannot be all that God has created me to be without you all. That being said, and I need the ritual of church, that when I cannot find my way, I come in and sit with you all, and you provide me a process, a ritual, much like we talked about funerals, that affirms who I am and who God is when I can't figure it out for myself. That being said, remember the first commandment, love God. The second commandment is for me to love you, which means, or because I've been talking about Matthew, Jesus says in Matthew, you know, I came to you, I was hungry and you didn't feed me. I was naked and you didn't clothe me. Well, I also believe that Jesus is saying, I was at risk for COVID-19 and you didn't protect me. So while I am needing liturgy and community, and while it is very true, the building that I go to is not the church. The church is in me, but the community is there. But if I am a Christ follower, if I follow Jesus Christ of Nazareth, who connects with the sick and the infirm and those who are being treated unjustly, then it is imperative that I connect, and this is Freda talking. It is imperative that I connect with my responsibility to connect, to care for the elderly and the child and the person who's at risk, which means I wear my mask, which means I stay home when I'm asked to, and I'm able to say, we can fellowship online. We can do these. God has graciously provided other means for us to do these things. I can stay in community with you guys and still protect those who are at risk. And I believe that the Jesus that I follow says, Freda, worry about the people at home and I'll take care of the bigger church. A quick note, I read something the other day that said, oh gee, when Noah and everybody was on the in the ark, and the dove comes in, Noah doesn't jump out and decide to swim over himself and see what's going on. He trusted God. I don't need to come to church to prove who God is. That's God's business. I can stay in the ark and keep everybody safe. So that's what the Lord has given me as I have sat with this.
Thank you.
There is one more question, which is where can people get tested? I believe that all of the different hospitals in the Richmond area have COVID testing. Some of them have drive-up testing available on Saturdays. And so I would say contact either the hospital near you or the Richmond Department of Health.
Their primary as well.
Say again?
I would start out with their primary care, either physician, nurse practitioner, or PA.
Okay, so start with your primary care doctor. Then that way you're with somebody that you know, and then you can check with the different hospitals as well. There's another Q&A question. Oh, wow. Someone has been very kind and said that they are involved in COVID-19 testing, and this is the most comprehensive discussion on COVID-19 between frontline workers and those helping us to deal with the pandemic. And they said, great job. So thank you. I think I'm going to say that means a lot to all of us. That's really appreciated. Okay, so it is 5:01. I moved my cords around so I didn't die. So thank you all very much. Please take care, and remember that our next virtual roundtable is going to relate to the other part of the other pandemic that we've been dealing with, and that should be coming up very soon. Thanks. Okay, bye-bye.
Thank you all.
And I think